This is a virtual tour of the intensive care department at University Hospitals Plymouth NHS Trust. We hope you enjoy this short video and we look forward to welcoming you back into the department when COVID is finished. This is the waiting room for the intensive care department. On your right hand side is the reception desk. This is where your relatives might have waited for you. This is the entrance to Penrose Ward, the general intensive care. This is the entrance to Pencaro Ward, the neuro-intensive care. This is one of our relatives' rooms. Your relatives may have been asked to wait here during your time in intensive care. This is another one of our relatives' rooms. This is a typical intensive care bed space with a bed in the middle. You can see computers, pumps and a ventilator and monitoring. This is the hand washing facilities. These are exactly the same at every bed space, with blue for soap, green for hand cream and red as a surgical scrub. The taps look quite strange and have handles that have up and down elements to it. This is a typical bed space. In this image you can see a monitor, you can see a stack of pumps and you can see the bed in the middle. Most of the bed spaces are faced away from the window. During your time in intensive care, the bed may have changed direction and you may have been able to sit in bed or in the chair and look at the view outside the window. None of the windows open in intensive care, so it is unlikely that you were able to have the window open, but you might have been able to see the view out of the hospital. This is the monitor. Your nurse will have sat here and entered your patient details and entered your observations the whole time you were in intensive care. There's lots of equipment hung around the bed space, so sometimes the bed space can feel quite full. This is the view from the end of your bed. You can see that there's more monitoring on the right hand side and a ventilator. The ventilator isn't currently set up. Later we will show you a ventilator that is set up. Ventilators can have blue or pink tubes. Most bed spaces have a window on either side of the actual bed. So you have a window at the back showing you natural light and a window on either side, so nurses in the adjacent rooms can support your nurse and can keep an eye on you too. This is your monitor and your ventilator close up. You can see a stethoscope hanging from the top too. All of these monitors, when you have been in bed, would have had lit up screens. We'll show you that a bit later. This is the nurse's observation trolley. This has drawers worth of equipment and you can see the yellow sharps box on the right hand side. Every bed space has a clock and every bed space has a hoist. That is the silver mechanism hanging down from the ceiling. You might have used this during your time in intensive care. On the left hand side of the screen you'll see a whiteboard. These whiteboards are used to communicate messages to the patient and you will have often had the weather and your nurse's name written on it. This is the apron and glove dispenser. As you can see, it's got 3 holes at the top for different size gloves and an apron coming out from the bottom. Sometimes patients can tell us that they remember these from their dreams. This is the view from a bed at the top of the bed. This might be what you looked at. This is the view from the ceiling. There's multiple lights in the ceiling in intensive care. Some are security lights and some are fire lights. Some of the security lights and fire lights have a small green light in the corner. This is just a safety feature. The vent, which is central to this picture, can look quite 3D. Some people tell us that in their dreams and in delirium in intensive care, they have seen things coming out of these vents and similarly to the light behind it. This is another one of our ventilation air sealing mounts used in intensive care. These are very important because they direct airflow and keep everybody safe and help reduce our levels of infection in the department. However, they can look quite strange from beneath. Some of our patients have these in their dreams too. This is a ventilator and a monitor in use. You can notice there's some green and red and blue writing on the monitor, and this is what your monitor would have looked like while you were in intensive care, because every patient in intensive care is monitored all of the time. The ventilator either has a white screen with blue writing or a darker screen with white writing. This would have been on if you were ventilated. These also make lots of noises, and we've attached noises and similar noises to the monitors and alarms that we've got at the end of this video. This is what your nurse would have looked like from when you were in bed. Notice that this patient has lots of the pumps in use. The nurse is sat at the bed space next to the patient for a lot of the time that they're in intensive care. This is where the nurse adds her nursing notes and records all of your observations. This would have been on your right hand side while you were in hospital. These are the portable computers that go around to every bed space when the medical staff do their ward rounds. There are 2 large screens on every trolley, and there are multiple trolleys in the department. Sometimes our patients have memories of doctors and people standing behind screens and typing. This is what they look like from the back. They have multiple wires and multiple power connectors. This is one of our support and emergency trolleys. This is used to support people with their breathing. This is a stocking up trolley or a stock trolley, and you notice that it's got lots of different coloured handles and lots of different stock. These are wheeled around the department regularly, and sometimes people remember these from their memories too. This is a view entering the link ward, which is bed spaces 14, 15, 16, 17, 18 and 19. Bed spaces 17, 18 and 19 are all side rooms, and they're on the right hand side of the picture. And 14, 15 and 16 are all in a row on the left. This is the computer desk in the link area for bed spaces 14 to 19. You might remember seeing medical staff sat typing at the relevant computers. This is another view from the back of a bed space to show you the things that you might have seen while you're in hospital. There's large amounts of blue curtains on show that surround every bed space. Some of the curtains are blue and some of the curtains are grey. This is the view of the nurse's desk and the medical desk for bed spaces 1 to bed spaces 10. This is visible from bed space 1, 2, 6 and 7. Often there are medical staff sat entering data and supporting patient care. Our medical staff wear different coloured clothes. Sometimes it's green scrubs, sometimes it's blue scrubs. This is a view of some of our equipment from bed space 3. Notice there's a window in the back wall. Sometimes our patients tell us that they remember looking through this window. You can also see cupboards on the right hand side. Multiple drugs and devices are kept in these cupboards, so you might have seen them if you were in bed space 3, them being opened and shut. This is a filter machine. This machine acts as a kidney when your kidneys require support. Blood goes through the tubes and into the large canister on the right hand side of the picture. This machine makes quite interesting noises and bleeps. It has fluid on the bottom and fluid on the top. Urine comes out at the bottom and is yellow. Your relatives might remember this machine. This is a close-up of the same machine, so you can see that the screen is grey with blue buttons. This is the view from the bed spaces circling round in bed spaces 1 to 5. Bed space 1 behind us and bed space 5 further in the distance. This is in general intensive care. On the right hand side of the screen you can see bed spaces 6 to 9, and in the corner is bed space 10. We hope this video has given you a taster of intensive care. Due to COVID, we're unable to offer visits at the moment. We hope when COVID is over we will be able to offer you and your loved ones a visit back to intensive care if you would like it. If you would like more information about intensive care or about anything you might have experienced in intensive care, please get in touch with the team. People often tell us that they remember specific things of intensive care. These include the noise, the temperature, the floor covering and the ceilings. We've included here a selection of some of the noises you might have heard while you're in intensive care. These might make some memories come to the forefront of your mind, and you might remember things from your time in intensive care in your dreams. Here's a selection of some of the noises that you might have heard while you're in intensive care.